Hi everyone, my name is Kelsey Meeks and I am a technical coordinator at Stanford Healthcare. Today I'm excited to share with you an introduction to the GE Revolution CT scanner. What's new in GE CT? We have the Revolution scanner. It has a brand new platform and a wide detector of 16 centimeters. The Revolution detector is 4 times the length of the older models. The VCT and HD detectors are only 4 centimeters. The wide detector enables us to get faster scan times. It can scan a head in 1 rotation, a heart in 1 beat, and a child's abdomen pelvis in 1 second. The whisper drive system reduces audible noise during gantry rotations by more than 50%. We have a Revolution scanner at Neuroscience, CCSB, which is a cancer center located in South Bay, and there is one in 500P at the new hospital. What we are going to cover in this presentation is basic user information, new terminology, how to set up a scan, and reasons to love the Revolution. The image here on the right is an example or a picture of the Revolution scanner. The table weight limit is 500 pounds or 227 kilograms. The bore is 80 centimeters. The field of view is 50 centimeters for both single and dual energy. The screen on the top of the gantry is similar to the Siemens system. It delivers personalized patient information. It will display the patient's heartbeat when EKGs are attached, and there are also videos via gantry displays. Options on the display screen are chosen by the arrow buttons on the gantry. So if we zoom in, we can see the older GE gantry buttons compared to the new one on the Revolution. The new button seen on the Revolution gantry control is a back button, enter, and a forward button demonstrated with the arrow keys. And then to the right, we have bore light adjustments. The tilt buttons on the VCT are not found on the Revolution because the Revolution does not have the ability to tilt the gantry. The keyboard is the same as the older GE systems besides one thing. Since the gantry does not tilt, there is no tilt button, and in place of that we now have a Cradle home button. This is similar to the Siemens system also. It will bring the patient out of the gantry. The Siemens system brings the patient out and down, while the Revolution will just bring the table out. This is nice to do in between your scans to remove the patient from the gantry without adjusting the table height. So this would be really good for claustrophobic patients. The GE has 2 monitors. The left one is the scan monitor and the right is the image monitor. So if we zoom in onto the left, we have the new patient icon, patient tab area, and the patient schedule drawer. The patient schedule drawer will open up the patient work list where we can select our patient from. Ideally, the only time we will use the new patient tab is when we are scanning the phantom. If the patient work list isn't populated, we can use this and type in the patient information and then fix it later in the packs. So this is the image monitor on stage left. This is where we find icons and system status area. This will be where there's reconstruction and image processing area. There'll be 4 viewpoints and a file manager. So how do we pull up a patient/exam? The patient schedule tab will have all the patients scheduled in this drawer. You can open this and click on the name, or you can also go down to the drop-down button and type in the session number. Once a patient is selected, you will see the patient information on the left, and you will type in the history/reason for the exam, the radiologist, and your name. On the Revolution, it is not possible to organize protocols once you click on a region. With the older GE models, you can see that the liver protocols are all together, and the same with the pancreas protocols. The Revolution does have a search box that will help you find protocols more easily. So this screen is just showing a comparison of the older versus the Revolution. A restart of the scanner and a daily calibration FastCal should be performed every 24 hours to ensure image quality. The tube warm-up is included in the FastCal, so you don't have to do it separately. The number of tube warm-up scans depend on the current temperature of the tube. The system confirms the gantry is in balance with a gantry balance check. The system confirms the scan window is clean with a scan window check. If the Mylar screen is dirty or obstructed, it can lead to image degradation, so the system will prompt the user to clean it and remove any obstructions. After the Mylar screen is clean, you can click Try to repeat a scan window check, or you can click Continue to proceed to FastCal without repeating the check. The system requires that all KV and MA settings be within specific ranges. These ranges are established and maintained by performing error calibrations. Here are the steps to complete the FastCal. From the image monitor, we will click on the Utilities icon located right there. From the Utilities menu, we'll click on Daily Prep, then FastCal. The Service Calibration Tools window will open, and we will click on Run and then Start the scan. FastCal will take approximately 15 to 20 minutes. After the FastCal is complete, the next step is to scan the Phantom and perform a quality assurance scan. Scanning the Phantom. We will put the Phantom in the holder clipped onto the table. We will line up the laser lights with the lines on the Phantom. We will do an ISO center Phantom check, and then we will be able to scan the Phantom. Most of the time, the Phantom fails the image quality test due to the Phantom not being ISO-centered. The workflow for the Revolution is performing an ISO center Phantom check prior to Phantom scanning. It is important that the Phantom be handled with care and put away after each use. The Phantom should never be left clipped onto the table for long periods of time. This can cause the Phantom holder to break or bend. This screen shows you where the center Phantom ISO is located. You can find it under the toolbar under the System Tools, Calibration, Center Phantom ISO. Once you click on this, you will click on Run to perform the check. Once the check is complete, it will tell you to move the Phantom which way if needed, up, down, or right or left. Once the Phantom is ISO-centered, you will click on the New Patient tab, label the exam for the QC scan test, and you will find the Phantom protocol under Miscellaneous, Daily QC, or you can search for it. Once the Phantom scan is done, the next step is coming over to the images and selecting the LCD. You want to highlight all the images 1 through 16. You will go back into the image quality and select Image Analysis. Make sure it is on Auto and 20 centimeter water Phantom. This will run a daily report. Any failures will automatically get sent to the GE headquarters. All right, once we have selected our patient and the protocol, this is the scan setup user interface. So we will just go through the numbers that are labeled. So if you see number 1, this is the tabs area and it displays patient session. Number 2 is above the patient's name and this is the state area. It indicates the scanning state of the system. It will display scanning or done scanning. Number 3 is the patient positioning area. If you hover over the body, it will give you arrows to orientate the patient as they are on the table. This is also where language is selected. If the patient is non-English speaking, you click on English and it gives you a drop-down box of different languages to choose from. Number 4, this is our scan timeline area where the prep group and delays and real-time scan progress information is displayed. Number 5 is the scan task list area. It shows the series scanning tasks to complete an exam. A blue background means confirmed but not scanned, and a gray background and check mark means scanned. Number 6 is our scan settings window. It has a series of drop-down menus to set and adjust scan parameters. There are multiple scan modes on the Revolution. Manual uses constant MA for the scan, so this is what we would use for extremities. KV Assist is similar to the CARE KV on Siemens system. Smart MA is addition to Auto MA. Smart MA enables tube current modulation along both the longitudinal axis and angularly about the patient. Figure A is an example of Auto MA, and then Figure B is an example with Smart MA, where there are two tube current values, one for the y-axis, the AP, and the other for the x-axis, which is the lateral direction. The tube current is modulated 4 times for each rotation as shown in Figure C. Organ dose modulation automatically reduces dose for superficial tissues such as the eyes, thyroid, and anterior chest, creating a virtual shield for sensitive anatomy, as you can see in the picture in the middle. GSI is the dual energy on the Revolution, and it stands for gemstone spectral imaging. The gemstone is the first new detector material in 20 years. The material used is called garnet crystals, which is pictured here in the right bottom corner. Gemstone's recovery time is 4 times faster than comparable detectors, and its primary speed is 100 times faster than competitors. GSI provides information about the chemical composition of body materials, allowing the user to separate calcium, iodine, and water to aid in characterization of pathology. Okay, going back to the exposure setup, user face, we have number 7. This is our total accumulated dose for the exam. Number 8 is the dose display area, and this displays the projected info based on current scan settings. This is where we will reference and check our CTDI. Number 9 is the quick settings area. This box is called a widget. It contains functional tools related to the scan mode selected. MA is the only scan technique adjustment we can make when we're in GSI mode. If the correct CTDI cannot be met with the highest MA, we would adjust the scan technique in this black box called the widget. Generally, we would only use this for large patients. All right, let's go ahead and move to the right monitor, the image monitor. On the right monitor, we have the icons and system status area on the top. So number 1 is the mode icon. This is where we will restart and shut down. We can play the audio voice per language. That way the patient can practice hearing the instructions before we start the scan. And it'll also have our protocol manager. Number 2 is our system utilities icon. This contains our daily prep, system tools like message viewer, service tools, troubleshooting, and iLink. Number 3 is our Recon management. It opens the Recon management window to list the in progress and completed reconstruction jobs. Number 4 is the tube status icon. Green is a warm tube, yellow recommends a tube warm-up, and blue, the tube is cold and must perform a tube warm-up. Tube warm-ups are very important. They extend tube life and are done quite frequently on the Revolution. The only time we should scan patients when it is in the green. Number 5 is our available disk space. This is how you will know when to delete exams. Underneath the icons, we will have the reconstruction and image processing area. On the left is where we check our recon ranges, add recons, duplicate recons, and add reformats. The measure / annotate is a drop-down box that reveals tools. This is where we will go to measure Hounsfield units, for example. The little box to the right of the recon will be how we bring that recon to the bigger 4 viewing boxes once the images are acquired. The viewports also have a toolbar that appears in the top. This toolbar will have an option to maximize the view box to view the images larger. So these 4 boxes in this square correlate to the 4 boxes to the right of it. All right, so the Revolution has a metal artifact reduction called the MAR. So when we perform the scouts and we see that the patient has a lot of metal, we would normally use 120 kV and a pitch of 0.5. Okay, this is the same patient from the scout images with the metal hardware in the spine. As you can see, the MAR cleans up the streak from the metal quite a bit. The downside of MAR is it does change image quality texture. It can reduce trabecular detail and make it look like there is bone loss. The workflow is to submit a with and without MAR and then label them accordingly. Here's another example. This is a knee replacement with and without the MAR. When we open the KV and MA control drop-down, we will see the KV mode is GSI. The low and high KV, the CID link is on, and the GSI profile is body at 2.5. The first step is to turn the CID link off and then change the GSI profile to the body plus MAR option. As you can see in the lower images, this automatically changes the pitch from a 1 to a 0.5 and the rotation time of 0.8 seconds to 0.5 seconds to slow the scan down and get more x-rays. Using GSI, we have parent and child recons. The trident icon is the parent and the ones underneath it is the child. The box icon recons underneath the child is the reformats. Click on the advanced recon parent, make sure the GSI assist link is on, and make sure the body plus MAR is selected. This will give you additional MAR recons. Okay, this is a picture of the Revolution CT technique chart. We have the full dose in single energy and dual energy, and then a low dose in single and dual energy. As you can see, for the dual energy range for 300 plus patients, there's 3 X's. The workflow will be if the patient is 300 pounds or more, we will go from dual energy to single energy. This is the technique chart for the Revolution's cardiac mode, also in full and low dose. So there are some changes for the stroke protocol. There is no gantry angle, so it's very important to tuck the chin as much as possible in the Revolution to avoid scanning the lens of the eye. There is 1 injection of 40 mL of contrast for the perfusion run. Reminder that the default is to load ISO 370 when an emergent situation in GFR is unknown. The table will not move, and then there will also be a fast head stroke protocol if needed, which will scan less than a second. After the scouts are done, the first thing to do is highlight the full field of view start and the full field of view end. This will make sure that your first run and second run are the same. Unlike the older GE models, we will not type in start locations. We will find the lens of the eye and move our blue box out of it. If we type in numbers, it will change the range of our perfusion scan, and we do not want to do that. There is a 1.5 second sample rate to capture the arterial peak enhancement, and then a 3-second sample rate to cover the downhill curve of enhancement. We can cover the start and the end because we cannot make adjustments to those. The only thing to note is the area does get scanned and visualized as the blue line under the blue box, as you can see on the scouts. There's that little blue line. Another new feature the Revolution has is smart patient centering. This feature helps to detect suboptimal centering prior to the diagnostic scan. When the scout is acquired, the system will assess patient centering and suggest table movements to accomplish this. It will prompt you to move the table up or down. At Stanford, we always do 2 scouts. The first scout will help you acquire the ISO center, and then the second scout will be used for calculating dose. Okay, so let's go ahead and do a scan. Once the scouts are completed, you can move your box to get the scan range, or you can type in the location under the anatomy selection drop-down menu if you want to type in your numbers. The drop-down menus are termed collections, and you can open them up with their little icon. Under the anatomy selection is the KV and MA control tab. We will use GSI for generally all body scans. The KV mode is GSI. KV shows the low and high KV to be used. The CID link is on for the GSI profile body at 2.5, and the MA mode is GSI manual. For MA, we will choose to get the appropriate CTDI for our patient. This picture on the right is the MA options. The last thing is the focal spot size in the KV and MA control tab. The next thing we'll do is put in our oral and IV contrast. The collection after that is timing. For our cap, we have 70 seconds. If the patient did not speak English, we would have had changed the language in the beginning and confirmed the language in the voice, lights, timer selection. Scan type collection shows we are scanning helical with the high-res mode off, and the rotation time is 0.8 seconds. The coverage speed collection will inform us of the detector coverage, pitch, coverage speed, rotation time, and total exposure time. If we were scanning single energy, then we would be able to change our pitch and rotation but using GSI, we will need to make adjustments. We will have to go to use the widget. The last collection is the primary Recon, and this is right there. Looking at the right monitor, the image monitor, we see the list of recons for scanning a chest and pelvis. Once again, in dual energy mode, the parent is the master recon with the trident. The child is underneath the parent, and the reformats are built off the child. Before scanning, always check the parent recons to make sure it has the appropriate scan range. The chest is only going to be in the chest, for example, and then you'll make sure the abdomen pelvis is diaphragm through pelvis. If we were scanning an angio, this is how the screen would look. You can set up the angio and the delay side by side, which would be helpful if they are the same ranges. Or you can also do them one by one individually. Before acquiring the Smart Prep, you must match your times. To be able to adjust the diagnostic delay, you must turn the auto minimum to off. The Revolution lets us enable dynamic transition, which will allow the scan to start off automatically when the Hounsfield unit hits a certain number. This option appears after the Smart Prep is taken. What scans are we not doing currently on the Revolution? We are not doing HRCTs and gout, and then functional gated studies are going to be back up to the dual source scanners. So reasons to love the GE Revolution. We have a large single field of view for dual energy. There's the same field of view range for both single and dual energy, unlike the Siemens. We can do dual energy PE scans. We can scan fast heads. We're able to scan the whole heart with one detector, so we have no misalignment artifacts. And then we're able to set up the scan before the patient is in the room. The Revolution lets us jump ahead to our different steps. Okay. All right, thank you.